Hi, let's just quickly go through the various different features of the Ataxia Telangiectasia and the Friedreich ataxia. So the ataxia will be shown here by this dysregulated taxi, which means that once the taxi is out of order, so it means that there are some cerebellar ataxia going on. So in both Ataxia Telangiectasia as well as the Friedreich ataxia have this cerebellar ataxia, but you have to differentiate them based on their features, and you have to memorize various different features of them. So Ataxia Telangiectasia will be shown by this our Spider-Man, which has got a telangiectasia on his chest, whereas the Friedreich ataxia will be shown by our lovely Friedreich, who is trying to fry because his taxi is out of order, and another mechanic is under it trying to fix his taxi. So let's try and start with the Ataxia Telangiectasia. So Ataxia Telangiectasia is basically caused by the defect in the ATM gene, and this ATM gene is basically responsible for the repair of the DNA. So now once the DNA cannot be repaired, so what happens is that these patients tend to be at increased risk of leukemia and lymphoma, which can be shown by these oil as well as water that is dripping down. So increased risk of the leukemia as well as lymphoma. You can see that there is a IgA which is broken down the number plate of this taxi, and hence these patients tend to have decreased AGA. Again, the other way you can remember is, as our Spider-Man has thrown away his shirt and because there was a B on it, so you can remember that there is decreased B and T in these patients. So because it is also one of the combined immunodeficiency syndromes. So and due to that reason, what happens is these patients tend to have decreased IgA as well, and the IgA tend to cover the mucosal surfaces and help you protect from these various different pathogens, and hence since these patients tend to have low level of the IgA, they tend to have repeated infection. Also due to the low B and T as well, they tend to be on repeated infection. The other thing is these patients will tend to have telangiectasias. So Ataxia Telangiectasia, you will have ataxia, cerebellar ataxia signs. The patient will also have telangiectasia. They will have decreased B and T function, low IgA, repeated infection, and increased risk of leukemia and lymphomas. Now coming down to the Friedreich ataxia. Again, the Friedreich ataxia, you will have the cerebellar signs of ataxia, which is shown by this disordered taxi. So, and the other thing in these patients will have is these patients will have the extensor plantars as well as the absent ankle reflex. I'm sorry, the ankle reflex, let me just correct that. Now where the heck is the pen? Okay, there is our pen. So if you see these patient boots, so he has been wearing the work boots. So these work boots can help you memorize that these have extended pads, and as well as they are up to the ankle. So these will have absent ankles. You can't see the ankles in these boots. So absent ankles and extended plantar padding, so you can memorize it that there is extensor plantar. So extensor plantar and absent ankle reflexes in these patients. Also you can see a hammer present there, which can help you memorize that these patients tend to have hammer toes. The other thing is a screwdriver around, we call it peshkash in Urdu or Hindi, so you can memorize it's pescavus. Just try to memorize it in some way. Pescavus, hammer toes in these patients occurs. The other thing that occurs in these patients, as these patients tend to have a high arched palate, and these tend to have the dorsal column defects. Now the dorsal column basically is a spinocerebellar tract, which is mainly dysfunction in these patients, which you can see from this ladder, which is from going down to up. So it helps you memorize the spinocerebellar tract, and it is at the dorsal column. The other manifestations include the optic disc atrophy. Our lovely gentleman is kyphoscoliosis, so you can memorize that as well, kyphoscoliosis, and also he has got a big heart logo, which can help you memorize HOCM, which is hypertrophic obstructive cardiomyopathy, which tends to occur in these patients. The other manifestations include that these patients tend to be diabetic as well, as you can see a loads of sweets around, and the basic the genomic the genomic defect which is present in this patient is basically this GAA repeat. You can see the garlic. So these GAA repeat which are present in the chromosome number 9 of this patient, and that then tend to which then leads to all of these manifestations which you can see. So here is your ataxia telangiectasia and the Friedreich ataxia. So in the Friedreich ataxia you will have cerebellar ataxia sign, high arch palate, dorsal column dysfunction which is the spinocerebellar tract, optic disc atrophy, HOCM, kyphoscoliosis, diabetes mellitus, GAA repeat on the chromosome number 9. You will have extensor plantar, you will have absent ankle reflexes, you will have hammer toes, as well as pes cavus. And that is all that you need to remember and memorize about the ataxia telangiectasia and Friedreich ataxia.